As I interviewed a father about his experience of losing his daughter to anencephaly, he said to me, "Everyone wants this to be like a book, with a beginning and an end, so that when I walk out of those hospital doors, that book can be closed, put on a shelf, and never thought of or spoken of again. But it's not like that, at least not in my experience." This father is not alone in attempting to integrate his grief into his everyday life as he returns to his societal obligations. Parents who have experienced perinatal loss have a disproportionate burden of chronic, adverse, preventable outcomes following their loss experience. Things such as endocrine, cardiovascular, and immune disorders, depression, anxiety, post-traumatic stress. In fact, up to 60% of parents who experience perinatal loss continue to experience symptoms of traumatic stress up to 5 years after their loss experience. I am Dr. Berry, a nurse researcher in perinatal loss, grief, and bereavement with a specialty focus on trauma-informed care. I became interested in perinatal loss when my sister's first pregnancy was complicated by anencephaly. She asked me to be her resource and advocate and support her during her experience. I was amazed by how few resources were available. As I watched families make the assumption that once they walked out of those hospital doors, the experience was over. There was a sigh of relief. Everything could return to normal. I watched my sister and her husband continue to grieve and struggle as they were not ready to return to normal. They did not have the tools that they needed to integrate their experience into their everyday life and continue with a healthy and productive life. In fact, that quote was from my brother-in-law as I interviewed him about his experience. In this presentation, I will share resources with how healthcare professionals can support families in the days, weeks, and months following their loss experience. There is a toolkit that has been developed. It is evidence-based, based on research findings as well as literature in how we as healthcare professionals can step up and help families integrate this experience into their life, help them heal in their grief. During the presentation, there will be some explanation and lecture, there will be interactive case studies, and there will be a toolkit available to all attendees to bring back to their institution and facilitate development of a perinatal loss follow-up care protocol. We have improved perinatal loss care in the intrapartum phase. Now it's time to take it to that postpartum phase to follow up with families and continue in those days, weeks, and months after their loss experience. I look forward to seeing all of you in New Orleans, and thank you for listening.